Intraventricular hemorrhage, IVH, remains a significant concern for premature infants. The severity of IVH is classified into 4 grades, with higher grades indicating more extensive bleeding and greater risk of adverse outcomes. Intraventricular hemorrhage, IVH, is a serious condition that can occur in premature infants, particularly those that are born before 32 weeks of gestation. It involves bleeding into the brain's ventricular system, where cerebrospinal fluid is produced and circulates. The condition is most common in the first few days of life, and it's a significant concern due to its potential impact on infants' neurodevelopment. What are the causes and risk factors of IVH? IVH, intraventricular hemorrhage in premature infants, is often associated with prematurity. The most significant risk factor for IVH is prematurity. The earlier a baby is born, the higher the risk of developing IVH. Infants born before 32 weeks of gestation are particularly vulnerable because their brain blood vessels are extremely immature, fragile, and they are not fully developed. The next risk factor is low birth weight. Low birth weight infants with birth weight of less than 1,500 grams are at higher risk of IVH. Low birth weight often accompanies prematurity, compounding the risk. The third risk factor, respiratory distress syndrome, RDS. RDS is a common condition in premature infants where the lungs are not fully developed, leading to breathing difficulties. This can cause fluctuation in blood oxygen level and carbon dioxide levels, which may increase the likelihood of bleeding in the baby's brain. Mechanical ventilation is the next risk factor. The use of mechanical ventilation to support breathing in premature infants can cause rapid changes in blood pressure and intracranial pressure. These fluctuations can contribute to the risk of rupturing fragile blood vessels in the brain of premature babies. Then, fluctuations in blood pressure. Premature infants often experience unstable blood pressure, which can lead to intraventricular hemorrhage. Hypotension, which is low blood pressure, or hypertension, high blood pressure, can both stress the delicate blood vessels in baby's brain. Maternal infections or neonatal infections can increase the risk of IVH. Infections can cause systemic inflammation and sepsis, leading to altered blood flow and coagulation disorders, which can precipitate bleeding in the brain. Then, birth trauma is a risk factor. Difficult or traumatic deliveries, including those involving the use of forceps, for example, or vacuum extraction, can increase the risk of IVH. Physical stress and injury during delivery can cause or exacerbate bleeding in the head. Then, chorioamnionitis. Next risk factor. Chorioamnionitis is an infection of fetal membranes, and it's associated with increased risk of preterm birth and then subsequent intraventricular hemorrhage. The inflammation caused by this infection can adversely affect the fetus's developing brain. And then finally, male gender. Studies have shown that male infants are at slightly higher risk of developing IVH compared to female infants. The reasons for this gender difference are not entirely understood, but it may be related to hormonal and developmental factors. How do we classify intraventricular hemorrhage? IVH is graded on the scale from 1 to 4 based on the severity of the bleeding. Grade 1, bleeding is confined to something that is called germinal matrix, which is a highly vascularized area in the brain. I need to elaborate a little bit here on germinal matrix. Let me explain what it is. Germinal matrix is a highly vascular region that is located in the subependymal layer of the lateral ventricles in the developing brain. It is composed of the dense network of very fragile blood vessels and proliferating immature neurons that contribute to brain development. Germinal matrix produces new neurons that migrate to different parts of baby's brain, including cerebral cortex and subcortical structure. The blood vessels in the germinal matrix are thin-walled and they lack of structural maturity found in the vessels of fully developed brain. These vessels are prone to rupture in premature babies under conditions of fluctuating blood pressure or hypoxia leading to bleeding. Germinal matrix is most prominent between 24 to 32 weeks of gestation. That's why the bleeding to the brain, baby's brain, is most common during that period of gestation, gestational age. After 32 weeks of gestation, the germinal matrix begins to regress as the brain continues to develop. Germinal matrix is generally no longer present after 34 to 36 weeks of gestation. And now, grade 1 IVH, that the least severe form, the bleeding is confined only to germinal matrix, and it often resolves without any significant long-term effects. Grade 2 bleeding is in germinal matrix, plus bleeding extends into the ventricles. Ventricles are spaces that hold cerebrospinal fluid, which is a cushion for our brain. So it extends to ventricles, but without ventricular enlargement. This grade indicates a moderate level of bleeding, but usually does not cause severe complications. Grade 3, bleeding is severe enough to cause ventricular dilatation, enlargement, which means that the blood is filling and expanding the ventricles. This can increase the risk of pressure on surrounding brain tissue. And grade 4, this is severe bleeding, more severe form, where the bleeding extends into the brain tissue itself. It often leads to significant brain damage and long-term neurological problems. What are the symptoms of intraventricular hemorrhage? While some infants with IVH may not show any immediate symptoms, others may exhibit apnea and bradycardia, so periods when breathing stops and heart rate slows down. They may be pale or they may have blue skin color, which is called cyanosis, that is indicating low oxygen levels. Those babies may have weak sac, difficulties feeding. Some babies may even have seizures, abnormal movements, or convulsions. Lethargy, it may be a symptom as well, extreme drowsiness and unresponsiveness. Or they may have also bulging fontanelle soft spot. It's a swelling of that soft spot on baby's head. How do we diagnose IVH? IVH is typically diagnosed through cranial ultrasound, which is a non-invasive imaging technique often used to detect bleeding in baby's brain. Sometimes the medical team may order CAT scan or MRI. Those two studies may be used in more severe cases to provide detailed images of the brain structure. What is the treatment of IVH? The treatment of IVH focuses on managing symptoms and preventing further complications. Number 1, monitoring and supportive care. So careful monitoring of vital signs and providing respiratory support if it's needed. Number 2, managing blood pressure. Very important, stabilizing blood pressure to prevent further bleeding. Number 3, surgery. In severe cases, surgical interventions like ventriculoperitoneal shunting may be necessary to drain the excess of fluid and relieve pressure on baby's brain. The prognosis for infants with IVH varies depends on the severity of bleeding. Mild IVH, grade 1 or 2, many infants with mild intraventricular hemorrhage will recover without significant long-term effects. Severe bleeding, grade 3 and 4, can cause neurological damage, brain tissue damage due to increased intracranial pressure and direct injury from the bleeding. And this damage can impair critical brain function. This bleeding, severe bleeding, can also cause hydrocephalus. It can lead to post-hemorrhagic hydrocephalus, a condition when cerebrospinal fluid accumulates in the brain's ventricles, causing them to enlarge. This can increase pressure on the brain and requires medical intervention, often involving surgical placement of a shunt to drain the excess of fluid. Severe bleeding can also cause seizures. Bleeding in the brain can irritate brain tissue and lead to seizures, which may need to be managed with medication. The long-term complications of intraventricular hemorrhage include intellectual disabilities, behavioral and emotional challenges. Children with history of IVH may experience behavioral issues such as hyperactivity, attention deficit, and social interactions difficulties. It can lead also to chronic health issues. IVH survivors may have ongoing health issues such as epilepsy, which requires long-term management and treatment. They usually need a special education and therapy. Many children with IVH require specialized educational services, physical therapy, occupational therapy, and speech therapy to help them to achieve their full potential. Prevention of IVH. Preventive measures include, number 1, very important, antenatal steroids. Administering corticosteroids, betamethasone, to mothers that are at risk for premature labor between 24 and 34 weeks of gestation. These steroids, betamethasone, help accelerate fetal lung maturity and also stabilize blood vessels in the brain, reducing the risk of IVH. Then optimal delivery practices, minimizing trauma during delivery by using gentle and appropriate techniques, especially in cases of breech presentation or the need for assisted delivery like forceps or vacuum extraction. Then delayed cold clamping, allowing a brief delay, 30 to 60 seconds, in clamping of umbilical cord after birth to ensure better blood volume and reduce risk of hypotension in the neonate. Cesarean section delivery when it's indicating. Performing a cesarean section in cases where vaginal delivery poses a higher risk of trauma or distress to infants, such as in cases of severe preeclampsia or placental abruption. And postnatal prevention strategies when the baby is born. Management of RDS, respiratory distress syndrome. So using surfactant therapy to treat RDS and stabilize the infant's breathing. Employing gentle ventilation strategies to minimize fluctuation in intracranial pressure, such as using continuous positive airway pressure, so CPAP, instead of mechanical ventilation when it's appropriate and indicated. Careful monitoring and stabilization. Continuous monitoring of blood pressure, oxygen levels, blood glucose to maintain stable physiological parameters. Also, using gentle handling techniques to reduce stress and the risk of fluctuation in intracranial pressure. minimizing fluctuation in that blood pressure, so avoiding rapid fluid administration, and ensuring that blood pressure is carefully controlled to prevent sudden increases or decreases that can stress the very fragile blood vessels in baby's brain. Then early diagnosis and treatment of infection, so prompt identification and management of neonatal infections to prevent systemic inflammation that could contribute to IVH. Head positioning, that's important, keeping the infant's head in the neutral position midline to promote optimal blood flow to the brain and reduce the risk of bleeding. All those measures help to decrease the risk of intraventricular hemorrhage. In conclusion, intraventricular hemorrhage, IVH, remains a significant concern for premature infants, particularly those born before 30 weeks of gestation or with very low birth weights. This condition, characterized by bleeding into the brain's ventricular system, can lead to severe short and long-term health complications, including neurological damage, developmental delays, motor and cognitive impairments, and hydrocephalus. The severity of IVH is classified into 4 grades, with higher grades indicating more extensive bleeding and greater risk of adverse outcomes. Preventive measures play a crucial role in reducing the incidence and severity of IVH. These measures include comprehensive prenatal care, the use of antenatal steroids, optimal delivery practices, careful postnatal management to stabilize and monitor the infant's health. Advancements in neonatal care, such as improved ventilation strategies, early intervention services, and ongoing research into new therapies, offer hope for better management and outcomes for premature infants affected by IVH. Additionally, educating and supporting families is essential to help them to navigate challenges associated with caring for a premature infant at risk of IVH. If there is any questions and concerns, please contact me at neonatologyforparents.com.